Okay, let's start with, well, this case which I have picked up, it is a real scenario which you can get in the examination, both in the DNB as well as in the MS Orthopedics examination. And as Dr. Dimri has also told us that maybe if you are appearing for an FRCS exam, you can be sort of taken down the line just by showing a scar or dwelling on an injury further. So I think more participation is welcome in these interactive sessions. This patient, I will give you a brief history of this patient. He had recently come to me about 10 days ago in the OPD of my hospital, orthopedics department. He's a 30-year-old factory worker who presented with loss of sensation predominantly in the index and middle fingers of his right hand. The right hand happens to be his dominant hand. When I asked him since he was presenting 2 months later, the scar had already healed, I asked him, how did you sustain this injury? So he told me that while walking in the factory, he slipped and he fell down. It was the injury was not sustained while working on a machine, but it was due to a fall while walking on the floor, and he happened to hit the sharp edge of a drain cover which was there on the floor. There was a drain there and it was covered with a metallic jali sort of a thing which had a sharp edge. And this whole episode happened 2 months ago. So if you look at the structure of the history which I have presented here, it gives you an idea of, number one, what is the problem for which the patient has come. So as far as what is concerned, it is loss of sensation predominantly in the index and middle finger. How did it happen? So it happened, the mechanism of injury I've already explained to you. And when did it happen? I think these are three very relevant questions which need to be asked in such a case. And thereafter, I show you his hand, which tells you a bit of the story which Dr. Dimri has already told you, that whenever there is an injury and there's a wound or a scar, you can be asked several questions which we would look at shortly. But to start the interactive part of this, I would now like to ask Biju, on inspection or on looking at this hand, what do you find? What are your salient findings on inspection of this hand?
Good afternoon, sir.
Good afternoon.
I see a naturally healed wound scar on the
okay, so this is the scar. All right, what else?
On the volar, more towards ulnar aspect of the wrist.
Okay. What else is visible?
The little finger is in an abducted attitude.
Okay, little finger.
Yes.
Okay, what else? What are the most glaring features that you see in the hand? Saurabh, would you like to add?
Yes, sir. I can see the discoloration of the index finger.
Okay, this discoloration. All right. What else?
And there is a scar mark on the middle finger also.
Okay, so there is a healed sort of a scar mark on the on the middle finger also. What else?
And thumb position of the thumb. Uh, I think it is slightly. It's a might be rotated, not in anatomical position, I think.
Well, as far since this is only impression on looking at the hand, I think we should not uh, try to put too many things, only things which are very obvious. So what I feel is, if you look at this hand, these are the three things which are very obvious and which you should be able to pick up. So first is this scar. I think this was rightly identified, but I would expect the candidate to say, what sort of a scar is this? So this is a primarily healed scar. If you look at the scar, there is some sort of a stitch mark also here. So this looks like a primarily healed scar. It is an oblique scar. It is placed predominantly on, if you look at the segment of the distal forearm and wrist, it is predominantly on the ulnar half of the volar aspect of the forearm and wrist. I think this is very important, the position of the scar, because then the remaining part will come, that what are the structures which can be damaged by this. So if you look at this, this looks like the tendon of the flexor carpi radialis, or in addition, there may be palmaris longus also, but this is something like the tendon of the flexor carpi radialis, and this scar is ulnar to it, starting from the FCR, and it is predominantly ulnar to it, going all the way up to the ulnar border of the wrist. This is what we can see. Along with this, yes, you were able to pick up this black colored discoloration of the tip of the index finger, the pulp area, radial aspect. So this is the pinch area which is affected, and there is a blackish discoloration here. And obviously there is also involvement of the medial, of the middle finger, tip of the middle finger, pulp of the middle finger. There is a healed scar. Now these are the most glaring findings, but there seems to be some wasting of the thinner eminence, which probably will be more apparent once we compare with the normal side. And this is